Good afternoon and hello. Welcome to today's event, Healing Hands, Celebrating Health Center Nurses, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NACHC, and I'm pleased to bring you this event along with my division colleagues. Let's get started. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this live event. This live event is approximately 60 minutes, including introductions, presentations, and Q&A. Again, the duration of this live event is approximately 60 minutes. Feel free to use the chat box located in the lower right-hand side of your computer screen. Simply type your comments, questions, or concerns into this box at any time. Choose the "To Everyone" in the drop-down section that lets us know what your comment, question, or concern is. Friendly reminders that today's event is being recorded. All attendee lines have been muted and will be muted for the duration of this event. Chat box is open, located in the lower right-hand side of your computer screen. And we will be answering questions at the end of today's session. Any questions that we cannot answer in the time allotted, or if we need additional resources, an attempt will be made after the event has been completed. At this moment, I'm going to turn things over to Wanda, who is our moderator today, and as well as a speaker. Wanda, the floor is yours.
Thank you. Well, welcome everyone. I'm excited to welcome you today. Happy Nurses Week and International Nurses Day, and to all those that have joined us from across the country. I'm really excited to be co-presenter with my colleagues, Dr. Nancy Johnson and Joanne Diaz from Center for Creative Leadership. A little bit about me. Hi, I'm a nurse. I started in a federally qualified health center in Brooklyn, New York, Sunset Park, and have worked with health centers across the country when I was Northeast Director for Health Disparities. And I do have an eclectic background. I've worked in health centers. I have worked in primary care associations, foundations, and academia, but I'm really proud to be working with NACHC. I've worked with NACHC on several projects in the past. And so I'm a big believer in helping to amplify the voice of nursing and what nurses do. And so just know that you have an internal champion here at NACHC. I work as a senior fellow for public health integration and innovation and work on several projects here. But I have kind of taken nursing on as something that I want to, help promote and bring in, evidence-based research to this topic. My colleague is Dr. Nancy Johnson. She's the CEO of El Rio. And as a nurse leader, I'll say that we share a similar perspective of what is the importance of taking care of our community and using a generational lens. She has multiple sites of Rio in Tucson, Arizona, with over 700 employees. And she's also adjunct professor at the University of Arizona, and she has been recognized for her teaching excellence. And she's a great example of someone who kind of models leadership and supports the growth of emerging nurse leaders. And Joanne Diaz, I know from the Center for Creative Leadership, and she is a global leader with vast experience, really working on the Center for Creative Leadership. If you're not familiar with it, please look it up. Consider joining and getting access to a lot of the content and information there to grow as a nurse leader. Her focus is on designing and delivering customized leadership programs for managers and executives. She's leading and has led a women's leadership project for now a couple of years, all of these women leaders being in healthcare. So she's very familiar with the challenges that we face as women leaders or nurses in the field, but also I want to be inclusive of men, not just women. I think that today is really important for us to kind of take a moment and step back as we think of nursing and the stress that nurses have been under during this pandemic. And health center nurses and public health nurses working across the spectrum of our delivery system have played a real essential role, especially because of the populations that we serve. And I just wanted to kind of frame why today's discussion is so important. The American Nurses Association initiated a project entitled A Healthy Nurse, A Healthy Nation. And recently in October completed a survey of over 7,000 nurses that kind of compared pre-pandemic to where nurses are since the pandemic had started. And we have a higher rate of nurses reporting anxiety disorders, depression disorders, and nurses who have reported that they feel sad, down, or kind of depressed more often than before all of this. And I think all of us, with what we face in the front end of care delivery, have kind of grappled with the moral distress of this pandemic. So while forward facing and caring for our community, it's time to us to take a step back and self-reflect on us. And I think today's discussion will provide some insights and strategies on how we can be supportive of each other. At this point, I'm going to punt to my colleague, Joanne.
Thank you.
Oh, I have to, sorry, I so forgot to read the learning objectives. Next slide. So the learning objectives today for this webinar is for practice the behaviors that build psychological safety and discourage those that dismantle it. Promote at least 3 strategies to create a safe space at our work environments, and explore opportunities in our health centers to engage undergraduate nurses and future health center care team members. Now I officially can punt to Nancy, Joanne.
Thank you, Wanda. Hi, everyone. It's an absolute pleasure to be here today. I'll say this, the first time that I met Wanda, I think we had a 30-minute call scheduled and we went for well over an hour because she was sharing her excitement and passion for the work that she does and her excitement about our session today. So I have fed off of her infectious energy, and I'm very excited to be here today to talk to you all about psychological safety. And so just to start things off, what you are going to learn during this session is what psychological safety is, what it isn't, and what behaviors both build and break it. So to start us off, I'd like you all to think about a time at work where you were encouraged to admit mistakes, share ideas freely, ask for help when it was needed. Just take a second and think about what that felt like for you and what you saw people do in that situation. Usually when I ask that question, it's pretty instantaneous for people to be able to come up with a picture where you're part of a team and you feel like you're all moving together in the same direction. So I'm confident that you all have an image in your head right now. If I give you the opposite scenario to picture, think about a time where you could not speak up freely, or you found yourself being more silent, perhaps holding back from sharing things that you might have needed to or wanted to share in that moment. And do you remember that feeling? That inability to go beyond what you know you're capable of and actually share things and point out things that may not be going the right way. Typically, those 2 questions are able to prompt people to think very quickly about situations where they felt psychologically safe and situations where they have not. And so on our next slide, you'll get a quick overview of what psychological safety is. So this is our definition. Psychological safety is a climate where you can share ideas, you can ask questions, you can provide feedback, you can get feedback without a fear of repercussion. So the big takeaway from this is that in this sort of environment, there is a shared belief that it is safe for you to share something, that you will not be embarrassed, rejected, or punished for sharing something that maybe doesn't go along with the group or what everybody else is thinking. You can admit a mistake without the fear of repercussions, and you can be yourself. On our next slide, we've actually got a poll because what I'm curious about is to hear how often you feel that your voice matters and is heard. So you've got the directions on the slide right here.
Yeah, thank you so much, Joanne. And this is Elizabeth. There's 3 ways, and we'll drop that in the chat as well. Either you can use your smartphone and snag a picture of that QR code. You can go to menti.com and put that 8-digit code right there. I'm going to go to the next slide, which has the same exact information for you to vote. So I'm going to slide on over there. And Joanne, feel free to continue while people start to vote in the poll, and content or results should start to pop up shortly. And we already see one. So Joanne?
Perfect. Thank you, Elizabeth. All right, so we're starting to see this. I feel that my voice matters and is heard. So as these numbers come rolling in, it may shock you to hear this. I know that it shocked me and any other colleagues that I've ever shared this with. In a 2019 Gallup poll, they found that only 3 in 10 employees strongly agree with the statement that their opinions count at work. Thankfully, we're seeing better numbers in our poll right now, so that's a good thing. I'm grateful to see that. I'll give you another data point. As Wanda mentioned, I lead a lot of women's leadership programs, and one of the things that we found was that nearly half of female leaders face difficulties speaking up in virtual meetings, and 1 in 5 reported feeling overlooked or ignored during video meetings. So that speaks to the hybrid component of some of our lives, which isn't always realistic for all of us. But what I do want to call out here is that when employees aren't being heard in their work environment, the risk is that contribution and engagement dwindles along with a possible increase in turnover. We've seen this happen. We know this is a trend that's happening across the industry and honestly at this point in time across the globe, regardless of industry. But the other challenges is the decline in innovation and creativity. So we need people who have those voices, that have a different perspective to speak up in order to actually innovate, in order to create solutions that are different and unique. And we need that more than ever right now. And those voices are oftentimes those of nurses who aren't necessarily the dominant ones in the room, but the ones who need to be heard. So I'm going to leave this slide up for a moment and share a little bit more information with you. So in an environment that is lacking psychological safety, what we tend to see are behaviors that correspond to fear, mistrust, apprehension, concern, and guardedness. So that tends to become the tone, which means that not only does productivity decline, but there's also a risk to the team and of course to the patients that you all are caring for. One thing to note about psychological safety, what it's not, because a lot of times there are assumptions about what psychological safety is, since it's something that we tend to feel. It's not about being nice. It's not a personality factor. So it's not that someone has it or someone does not. It's not another word for trust. And it's not about lowering performance standards. So one of my absolute favorite stories came from Nancy Schlichting, who is the author of Unconventional Leadership and the former CEO of Henry Ford Health System. Nancy said, "I like to say yes to listening to ideas. I don't say yes to everything, but I want to hear the ideas. When people know they're going to be taken seriously, they put in more effort to prepare." And I love that idea because I've heard people talk about their concerns around opening the floodgates of too many or poor quality ideas as it might relate to creating an open environment. But psychological safety is actually about fostering a safe environment. So, what are some of the behaviors that can break psychological safety? And you're going to get a couple of slides that follow up on these after the session. But if you've got notes or something to write down right now, this might be of interest. Behaviors that we see that break psychological safety. Number one, multitasking. So being distracted, focusing on things around you other than the task at hand. This one is a challenging one because we have to do this constantly. But this is one of the things that can oftentimes break psychological safety in a team. Criticizing is another one. So attacking new ideas, being skeptical, disregarding contributions of others. Antagonizing is a third. So things like sarcasm and overuse of sarcasm or blaming others for mistakes can create that hostile environment, which will impact the way that team members show up. Denying is another one. So not recognizing your own or other people's nonverbals or emotional expressions. And then things like self-serving, so focusing on personal interests, ignoring the needs or contributions of the team, the individuals around you as a whole. So that's a list of things that break, and some of them may sound very familiar. Multitasking is always one that hits me because I know that I do it all the time. Now, what are things that can build psychological safety? Listening is the first thing that's on my list. And we oftentimes have heard about active listening and what that looks like, but I'll say this more clearly. Listening to understand. So specifically looking for not just the facts of what someone is sharing with you, but also perhaps the feelings that come with those facts and any values that may be underlying whatever it is that they're sharing with you. Listening at that level, being able to diagnose and understand the feelings and the values of what's being shared is one of the things that demonstrates true listening and can help build psychological safety. Be inviting others. So taking that pause to make sure that you're pulling in the opinion, the involvement, the ideas of others, even if it's just a simple acknowledgement, just to make sure you're checking in and you show them that you can see them. Learning. This is a tough one. So learning from experiences, but especially mistakes, and taking the time to reflect on what you can pull in from each lesson. We tend to move at such a fast speed that we'll acknowledge a mistake and then keep moving. But learning from experiences and then encouraging others to do the same, that role modeling behavior. Empathizing is one that may not be as surprising. So both being aware of and acknowledging nonverbals and emotional expressions, both in what you're sharing with others and what others might be sharing back. And then maintaining that inquiring mindset. So specifically with regard to conflict situations, leveraging questions to understand the other person's needs and finding a way to compromise using an inquiring mindset, a curious mindset, as we tend to say. Those are some of the behaviors. There are more, but those are some of the behaviors that can build psychological safety. Now, if none of those sound like a surprise, perfect. That is typically what we're looking for when it comes to leadership. It's not often things that are completely brand new, but it's things that perhaps we've forgotten the habit of practicing on a daily basis because we're moving so fast, because everything feels like a constant fire drill. And so sometimes it's just helpful to get a reminder of those things that will help increase safety in a space and therefore improve that that feeling of belonging on teams, increase that sense of cohesion within a team, but then also start to take steps towards addressing burnout and exhaustion that people tend to feel, especially right now. On my next slide, I've got a few summary items that highlight different tools that you can use to foster psychological safety. So I just described the behaviors, but these are actual things that you can create. So group norms. How are we going, before we jump into an agenda at the beginning of a meeting, whatever it might be, agreeing on how we are going to communicate, even if it's simple things like articulating ways to pause the conversation if you've got a question, ways to articulate if something's going wrong. So recently I offered an ouch and oops way to a group, and they gravitated towards it. These were healthcare leaders. And the ouch referred to the fact that if you hear something that hits you the wrong way or something that you know is off, you say ouch. And that'll give the group a chance to pause. We can address what happened in that moment. And it gives the person who perhaps misstated something a chance to say, oops, that wasn't my intention. This is what I meant to articulate. Having those norms in place creates a level playing field for everybody. And that goes a long way to creating safety in a space. I've already highlighted some of these other ones. So the active listening, the behavior list, expectation setting. So collecting expectations are what people hope to get from a session. And finally, the last one, set boundaries. So something like starting and stopping meetings on time. It's something that we don't think about very often, but that's a beautiful example of creating safety in a space because people know what to expect. They can expect us to start on time. They can expect us to stop on time. And so in the spirit of practicing what I preach, I'm going to stop at this point. You've got some resources on the next slide that you will have available to you with links and so forth if you're curious about any of these things and digging in further. The psychological safety topic came from Amy Edmondson, who wrote The Fearless Organization. Huge resource. But at this point in time, I'm going to turn it over to my colleague, Nancy, to continue our conversation.
Thank you, Joanne. That was wonderful. I'm really delighted to be part of this conversation this afternoon because I think it does remind us that we are all work in progress and we always have to practice some of these behaviors that we've heard about. So best wishes for Nurses Week. And I appreciate all the work that my colleagues do in health centers across the country. And also for all the passion that everyone has for community and public health nursing. But I just wanted to set, before I go on to the next slide, a little bit about where I come from here at El Rio. As you heard from Wanda, we are a health center of about 1,700 employees now. Over the 14 years that I've been there, we have grown from about 700 to about 1,700 employees. And we've grown from 6 health center sites to 13, opening our 13th health center a couple weeks ago. So with a rapidly growing workforce, we think a lot about nursing leadership and how do we build it and how do we create those really psychologically safe environments for all of our nurses. The last point about El Rio is that when I came to El Rio almost 14 years ago, we had very few registered nurses, which as a nurse I found to be, how are we running the place without nursing leadership in our health centers? So we're very proud to have a lot of nurses today. As you go to the next slide, I'm going to kind of set the conversation in that we started thinking about just nursing in the context of our health centers. And what does that look like? What should nursing leadership look like? I think to begin with, you know, we're so fortunate to be health centers and that we have very, very deep purpose. I'm reading a new book right now called Deep Purpose that talks about, you know, that essence of an organization that really draws people to be passionate, to be inspired in their work, and to be continually innovative. And I feel that that's where we sit in health centers, in that area of deep purpose. And then we kind of talked about, you know, reality of health centers and our patients over the years, kind of where we are today. And obviously, after 2 years of addressing the pandemic, being out in our community, helping in so many different ways with an evolving set of knowledge and science to deal with, we really learned a lot more about our patients from interacting with them virtually, from really seeing the impact of social determinants of health in a much more powerful and visual way. So we really felt, you know, who nurses are where we need to be amplifying our voices, as Wanda mentioned earlier, in that, you know, we need nursing leadership more than ever in our health centers. And most nurses have a very robust education of interdisciplinary care. When I look across my over 100 nurses that work in our health center now, I have everywhere from NICU nurses to psychiatric nurses to hospice nurses, all employed in addressing the needs of a very diverse community. And we continue to work on educating and developing leaders who have shared life experiences with the patients that we take care of. So just by fact of who we are, the opportunities are great. And, you know, our vision was to create a great community health centers for nurses to be able to grow and to lead and to thrive. And that's where we set our compass for our true north about 14 years ago. So as you look to the next slide, and you know, I'm also thrilled to share pictures that we just took in the last week of our nurses across our community in these slides. And, you know, I always go back to mission, and, you know, some people kind of close their ears when I talk about organizational mission because we all think about the mission of an organization. But as I mentioned, that is our deep purpose. And this has been our mission statement for over 50 years for our organization. About 7 or 8 years ago, we brought together all of our employees and we asked them to think about what are our values. And this organizational input brought forth these 6 value statements that we use across our organization. We start a lot of our meetings with storytelling, in sharing a story that illustrates one of these values and provides that kind of focus recognition for people, the compelling why that we do what we do in our health center. So today, in thinking about nursing leadership, I'm going to pull out the 3 value statements here that are kind of in that rusty orange color. I matter. I make a difference by voicing my opinion and knowing I'm heard. Value health. I take time for my own health to promote yours. And create tomorrow. I embrace effective change and I seek innovative solutions. And these are the 3 guiding principle values that we have used on building nurse leadership. If you look at our next slide, we'll start with I matter. Thanks, Elizabeth. So this is kind of setting the stage, and we started about doing listening sessions with all of our nurses about what matters to you. And, sat down to talk to them about what's your purpose and your experiences. Why are you here with us? Why do you work here with us? Why is this your place of employment that you're choosing? And then some questions about when nurses are at their very best, what does that look like for our health center? And then my question as leader is, and what else can I do? So those listening sessions did a lot for us. We found that, most of our nurses share that deep purpose of why we're here. And they really feel they're most powerful, I guess, or most useful to our patients and their colleagues when they are leading, when they're able to pull together care delivery, when they're able to problem solve, when they're able to really pull together the diverse talent set of our workforce to help address patient needs. And most of the time, what they're asking for us to do as leaders is, 1, help them with overcoming barriers, things that they have found in trying to do their work that really, from an administrative leadership perspective, we can remove. And then back to Joanne's comment about they want us to socialize their ideas, their innovation, their thoughts about what they could do. And, I'm kind of one of those leaders that pilot is like my favorite word. And then I'm always willing to pilot something, right? And so I love to innovate and try new ideas. And I find that this is a great area to support our nurses in their leadership growth and also our organization. We also do a quarterly engagement survey, and we do this just using SurveyMonkey or part of our HR tools. And, the things that I see come out through that survey, a lot about balance, particularly in the pandemic and finding too many competing priorities, being able to take care of their family as well as their patients. We've seen a lot of that in our surveys recently. And also, just they love what they do. They love the creativity, the autonomy they have. The more autonomy we can give them, they know what to do, right? And to watch their evolution and their desire to become leaders within our organization. I really like the question, if I could, I would. And usually this is where we find their pain points as to what is making their work and their delivery of care harder. And also, just areas for innovation. We pull a lot of great ideas out of there that we're able to further talk about in our organization. In our last quarterly engagement survey, I was delighted to see from our nurses working in the organization, 80% of them fell into the quadrant of engagement, 80%. So that feels good to know that most of them are engaged around what we're doing. And also in our organization, every senior leader has a leadership rounding responsibility every week. So this week I have one health center site that I go out and round at. And it's not what I call drive-by rounding. It's actually sitting down and spending time with the nurse leaders. We have nursing leadership at all of our sites. And, we spend time listening to them and helping them grow and evolve as leaders. And I think, also just in recognizing that our knowledge is always incomplete. Sometimes it's easy to say, I know about that, but our knowledge is always incomplete. And we need to always, always ask and never stop asking, and be able to follow up is a critical factor of setting that stage for I Matter. The next slide we have, I think Elizabeth is going to jump in with a poll here. Go, Elizabeth.
Thanks, Nancy. So again, folks, if you don't have it up or you joined the session late, we are doing a few polls throughout today's session. So either you can, Beth is going to drop it into the chat. If you want to join via your desktop, you can do that, or you can just take your smartphone and go to menti.com and put that 8-digit code in. I'm going to head to the slide so we can see the results live as they pop in. So give everybody an opportunity to start. Oh, well, there's already voting. So yes.
Yes.
Yes. So we'll keep this open for a minute or so, but Nancy, feel free to keep going and chat while people start voting.
That sounds great. And you are very good at that, I might add.
Thank you.
Thank you. So, you know, as we watch this a little bit, I'll bridge to the next slide, which is really taking all of that information I was sharing as our assessment platform. And we continue to use that data to work on our progress as far as building leadership. We see nursing leadership and coming in a lot of varieties, right? I have nurses that are evolving as leaders in our organization as our expert clinicians. We have some that are really forwarding the path around education and developing a really robust Department of Education and organizational development that we've not had historically. We have some of our other nurses that are really in administrative operational roles for the organization as COOs, chief clinical operations roles. And then what I'm working on right now that I'm super excited about is developing another track for nursing leadership around community-based research. In that we have so many people, you can go to the next slide there, that's perfect. And we have so many people with a lot of interest, a lot of clinical practice questions, a lot of operational community-based questions they'd like to answer. And in our academic affiliations, frequently we have principal investigators coming to us with their questions. So we're going to be developing within our organization the ability to really run some community-based research that's of interest to our nursing leadership and other leaders as well. So from this assessment and planning, those of you, all nurses, know that I am in my nursing process mode here. We then go on to looking at what kind of actions we wanted to work on. And we elected to work in 3 areas. First, systematic changes, innovative opportunities for our nurses and nurse leaders, and also working on amplifying nursing voices. And you can go to the next slide. And as we're looking at the next slide, one of the things we really referenced, and many of you may have read it, is the IHI's Improving Joy in Workplace document from a few years ago. So we really use that framework to think about the psychological and also physical safety in our environments, meaning and purpose. That's where all that storytelling comes in. Giving our nurses as much choice and autonomy as to how they wanted to build their practices. How do we build the team, the camaraderie necessary, and then really using that lens of fairness and equity. And, you know, I'll just do a short story. You know, one of those values you saw in an earlier slide was honor patients, right? The patient's needs are first. So one Friday afternoon, I get a phone call from one of our nurse leaders at one of our largest health centers. And she was calling to tell me about a woman who had come in with her 3 children who had just left an unsafe environment on a Friday afternoon and came into our health center. She said to me, so here's what we've done. We've seen the children, we've seen the mom, we've immunized everybody, we've fed the children, and we're just calling if we can get your credit card so we can put them in a hotel for the weekend so they'll be safe. So you see, nursing leadership, they know what to do, right? They step up, they break boundaries, and they're just calling to remove that barrier for the one weekend. So systematic changes. So some of the things we started doing in alignment with the framework was to have dedicated twice monthly time so that all of our leaders have a little bit of time when they can take time for themselves, when they can think about their own self-reflection of their performance. You know, I really like to have that piece of time when I realize I have been on my last nerve maybe with people, or I need to have someone go ouch and oops in my environment. And so we try to give the leaders that dedicated time twice a month. Now, sometimes they use it for mini education. You know, we have been doing a lot of training across the organization around nonviolent crisis intervention. And so they'll use that for like a little mini refresher on some type of a technique. So sometimes they use it with their staff, but sometimes everybody just has some quiet time twice a month for reflection, thinking, planning. So critical to leadership. And as Joanne mentioned, we're always busy. We are always in fast-paced mode. We also do morning huddles in our organization, and these are very short, but sometimes they're just around project updates in our behavioral health area. We are a fully integrated health center with medical, dental, behavioral health. Sometimes it's triaging a patient in crisis that happens in that morning huddle. And, you know, as I mentioned earlier, sometimes it's just, you know, working on little pieces of, you know, project puzzles. The third systematic change we worked on is around that value health. That was one of the bubbles I showed you earlier. I take time for my health to promote yours. So we've done a lot. We provide heavily subsidized YMCA memberships for all of our employees. I think they pay $7.50 a pay period for a family membership. That also includes childcare. So we've been able to get some of those barriers out of the way for people to take time for themselves. All of our employees have access to the Calm app that we encourage using. We report on utilization, facets we like and don't like, we share in our teams meetings and things too. And then we also, you know, offer a whole palette of health and wellness courses free of charge for all of our employees. Everything from Zumba to mindfulness to Tai Chi, all kinds of things that they can take advantage of, because those boundaries that Joanne mentioned and Wanda mentioned are so critical, and the opportunity to have access to whatever might be right for you. We've put together a lot of educational scholarships. We have a separate foundation. Average scholarship for any of our employees that want to go into nursing is about $3,500 a year, plus they all have an educational benefit. We've partnered closely with our local universities, our 3 statewide universities actually, as well as our community college to support training at the workplace. For example, we just finished training a bunch of our frontline employees to be medical assistants. We just finished training some of our medical assistants to become licensed nurses. They all passed their boards. They're now able to improve their compensation, obviously, but also be part of the growing leadership team of nurses at our health centers. So that kind of covers that career development piece that we've been working on as well. And then we do a lot of kind of iterative mentoring. We found that formalized mentoring wasn't very effective for us, that leaders kind of find leaders they're comfortable with or have shared interests, and we actively do succession planning around that. I'll just share one story of one of our employees who grew up in Tucson, a Latina, and she came to work for us as a referral clerk. She then went on to start her nursing degree, then became a referral supervisor in our health center. Upon getting her nursing license, she became a care coordinator. Then she rose to be a health center manager. And just last week, she was promoted to be one of our regional health center leaders over 4 of our health centers. And this is what leadership and nursing development looks like in health centers, right? We take care of diverse people. We need diverse leadership in our nursing leadership. And then we also, you know, promote, we offer an annual leadership development fellowship that starts every August. We encourage all new leaders, maybe leaders needing a refresher or a, I don't know, motivational, inspirational course, or aspiring leaders to apply. And through this group, we cross-pollinate across all departments and all areas with nursing, of course. And then we also cross-pollinate around our geographic locations. And it's a great way for people to develop as leaders. It gives them a full scope picture of the organization, everything from quality management to financial operations, clinical operations, population health are all part of that curriculum we offer every year. And then we've also supported many of our leaders to do policy fellowships with NACHC. So lots going on that we try to engage people in leadership. As you look at the next slide, I'm just going to lastly share some of our innovative opportunities that we have done. About 10 years ago, we hired our first nurse to work on discharge care management, to check into all of our patients who were going home from the hospital. And then from there, we built a 24/7 RN telephone care system. We have 30 nurses now that run that system. In addition to that, they do chronic care management for our Medicare population and are able to bill for those services, as well as manage high-risk patients that are referred to them from all different avenues. So those two areas were entirely built and are nurse-led initiatives in our organization. And we're super proud in that in the past year, they were noted to have the lowest emergency room use, lowest readmission rates across a population of 32,000 patients tied to one of our large Medicaid payers, and truly the work of those nurses. They're also right now, one of our nurse leaders is working on a care at home innovative project where she is designing and building that. Some of our nurses have gone back to become nurse practitioners, and they are now partnering with their previous colleagues around building this entire care at home project for our various patients. I might not have mentioned, we have about 125,000 patients in our health center. So lots of opportunities there. We are working on a geriatric center of excellence nurse-led project, also well populations where they are managing immunizations and well visits in our pediatric population, achieving immunization rates across the continuum of children through adolescence in the 95th percentile at some of those sites, which is awesome. And as I mentioned earlier, we're an integrated care model. And you know, it's easy to put people in one building, right? The dental people, the behavioral health, the medical people, you can put them all in one building. But the synergy of working together to achieve those patient outcomes is about the nursing leadership that helps them find that footprint to be able to take best care of patients across disciplines. A couple other things that aren't in this slide. I have one nurse that's working on our therapy dog program, and this met a lot of opposition initially, but these dogs have been hits in all of our health centers where we've deployed that. And we're doing some measurement around PHQ-2s and, you know, doing some depression screening and things among staff and patients with the therapy dog. And last but not least, we are now involved in resettling our Afghan refugees and nursing leadership around that, doing the health screenings, putting all the dots, connecting all the dots around the social determinants of health. So a very robust nursing leadership team. Lastly, and probably most important to my heart on the last slide, is really making sure our nursing voices are heard. This is a picture of myself and one of our fundraisers from our foundation, but most importantly, our mayor, our Tucson mayor, Mayor Regino Romero, who is a strong voice for nursing leadership. And you can see some of the ways we make our voices known. Almost all of us are involved in some of the community coalitions around the refugees, around preschool promise, around housing initiatives. We have a voice at the state and federal policy level, as all of us do, are related to health centers, but more recently around nursing, expansion of nursing roles and nursing shortages we're experiencing. We do provide health advice around policy to our mayor. We frequently write op-eds around access to care, 340B pricing. What else have we done lately? Telehealth in our local newspapers and websites. And then lastly, lots of community presentations and board memberships. We have nurses serving on school board trust funds, helping to figure out what kind of benefits are best for teachers and their dependents. We have nurses sitting on women's shelters, helping across the board. So we're really proud of amplifying the voice of nurses across our community and have lots more in play for the coming year. The very last slide I'll share before we look at hearing your voices around a cloud is this is our first group of employees that we supported through nursing school. Many of us served as adjunct faculty. I really shouldn't be teaching neurological nursing anymore, I've decided after that experience, but many of us helped to support them because after working all day, they came to class in the evenings did clinical rotations on the weekends, and we're super proud of their entry into the professional nursing profession. And just a final quote from one of our board members about nursing at the bottom. We are strong, and our strength comes from our vulnerability. Hidden saints who inspire us, risk all in order to excel in patient care, a healing presence for our patients, our community, and our organization. So thank you for the time to talk about our work. We are inspired. We are happy to share. And I'm curious about our next slide, which looks at asking you all to contribute to a cloud. Elizabeth.
Thank you. Thank you so much, Nancy. And we're going to go ahead and advance the slide. One more Menti, actually two more, but they're going to be back to back. So again, if you're late joining us, or just didn't refresh, feel free to go to menti.com, type in that 8-digit number, use the QR code if you like that as well. But the next thing is going to be something really fun, and we had somebody already submit in advance, so it gives you an idea of what to look at. But we've got a word cloud that's actually going to be coming up in just a second. So and there goes some words, and as people start to enter more things, so you can enter a full sentence, you can add just a word, just like the example that's on your screen. So the more responses, the bigger the cloud gets, and if there's similar themes, those words will get larger or bolder. So we're going to go ahead and give that a moment as all those words come in, and you can submit multiple times, folks. So take it away, enter whatever you want. We want to see it on the screen. It's going to be beautiful. And then I know Wanda's going to be up next. So Wanda, we'll definitely keep this up for about a minute or so. And feel free to start chiming in if you want while people add in their word clouds before we move on to your Menti. And Wanda, I think you're muted. I'm sorry. I could see your hands now. I just looked over to the left of my screen. I'm sorry.
That's okay.
There you go.
There I go. So I think I have a couple of questions, but for the sake of time, I do just want to quickly do my poll and then kind of get to conversation. But I think that as we continue to be challenged, sometimes if we're not challenged, then we won't change. And I kind of like some of the things that El Rio is doing, because I think taking time to reflect on ourselves as nurses, we really score really low on some of that stuff, taking care of ourselves. And sometimes we're also concerned about taking risks. So the analogy I use, that a turtle only moves forward if it sticks its neck out. So I am sticking my neck out right now in a sense of sharing something that I think is important. And it's a bit ambiguous, but I think that during this time of importance of connecting and creating space in a kind of fragmented, isolated way, sometimes we feel when we work across communities or even within our own org, or trying to learn what other colleagues are doing in other spaces, I have found a real refreshing in connecting with people by listening. And we've heard that from our two speakers. And I'm curious to whether nurses are even interested in what I'm kind of, naming like a nursing tribe, or meeting my peeps, across the country. And we'll have a poll there just to say yay or nay, whether people are interested in that. And I'll follow up to that conversation later. But personally, for me, I have found that when I had met with other colleagues during moments of isolation and just found other people that were creating a synergy around reflecting and healing and listening, that it really helped me kind of move forward through some, challenging times. And I think that for nurses in health centers, and when I'm out in the field, there's a hunger for connection. So I'm trying to create that as a senior fellow and figuring it out, but just wanted to get some input on that. One of the questions I have for Joanne, we'll let the poll launch, and we don't, as we're talking, and people can vote on that. One of the questions I have for you, Joanne, when we talk about the psychological safety space is, just the courage it takes to even open up and ask and be part of that. And kind of like, I keep thinking, when do I know I'm in a safe space compared to someone that where I'm sharing, they may take that information and use it against me. So how do you navigate that?
Good question. Thank you, Wanda. I'm a nonverbal processor, so what you're seeing is me processing your question right now. I'll I'll give you the answer, and then I'll give you my unfiltered Joanne answer.
Mhm.
Part of, I think, the way you set this up is how you start the conversation.
Mm.
A lot of times we jump right into it. Whatever it is that we have to share, we'll go straight to that point.
Mm.
At some point in the conversation, in the flow of things, you'll realize, I don't know if I feel comfortable sharing these additional details. Or we're holding back a little bit and waiting for the right moment. But it's really in the setup of the space that we establish what the guidelines are and how we can engage with each other. So even starting with things like, I've got something to share. And are you in a space where you can hear or you can take on a conversation about this? Or shall we postpone it to next time? Something like that.
Mm-hmm.
That's my advice on the professional side of things. The unfiltered Joanne answer is also, there are times where it may not be safe and it may not be the right moment in time. And we have to acknowledge those as well. So in those circumstances, it's looking for the alternate options to share information or have a conversation with someone, leaning folks around you who trust you and who you trust, who might be able to deliver a difficult message. If it's not safe for you as a particular individual to do so.
And in some ways, it kind of connects a little to Nancy, some of the work that you do at El Rio with the leadership rounding, right? So you're coming into the space of your teams, and they might be like, oh my God, you know, my senior leaders coming in. Like, how are you creating that space for nurses to feel safe, that it's okay to express? Listen, I like the analogy, or at least the question, the way you set it up. If I could, I would.
Yeah.
How do you do that?
Well, you know, I think the word Joanne said a couple times is trust, right? I mean, you have to come in and build that trust. You have to create experiences with them where they see that you have their back, you know. And I'm a big one to give credit and praise all the time to people. This was Joanne's idea. We kind of built on this. And I think as a leader, I am a relationship builder leader, in that the relationships with my employees are really important to me. That someone put in the word cloud, has my back, that they know even if I disagree or I have something to say, I don't think we can do that, because I have their back always. I have their back always. And, you know, our nurses are involved in the quality improvement process around what we call serious safety events. So if something happens, let's say a patient gets a wrong medication or something, or they picked up a wrong medication from the script, people in our environment generally feel comfortable saying, oops, right? Or that was a near miss. We better sit down and talk about that and figure out how we build redundancies in our process to keep people safe. So we have really encouraged that environment of, there'll never be a penalty for making those mistakes, you know, so we can talk about things and get better. So I think that relationship has to be one of trust. And I think it is really important that we are out there in the clinics, because we are in the business of taking care of patients. That is our core belief. Every day as a leader, I think about how can we do that better, right? Because I'm a nurse and that's what I think about. But I think if you're not out where the action is, it's harder to build those relationships. Sometimes I just sit down in the reception area and watch the patients like mosey around and listen to word choice of employees. And you have to be comfortable in that space, I think, to build those relationships. Because people tell me when something's wrong, they're like, oh, this isn't good, right? So I think it is about relationship building and not having a track record for punishing people or throwing someone under the bus, or you know, that kind of style.
And then say with the emerging leaders, you know, that you lead at CCL, predominantly it's women. And so one of the questions then I'm kind of, and both can answer this, which is, what is it that women leaders and those of us that are nurses bring to the table that people underestimate or undervalue?
So yeah, I mean, I was thinking about our nursing population, and what I'm happy about is I am seeing more males in our nursing population at the health center. And we're also seeing more people with language skills, bicultural. So that really, I think, is great because, I think one of the things that you bring as a nurse is that practicing as a nurse, you don't really have a chance to not feel comfortable with people, right? I can remember as a very young nurse, I mean, I started off working in a hospital in an ICU, and I mean, you are with people, you are touching their bodies, you are doing procedures, you are dealing with tough things. So I think that nurses bring grace in our communication with people. We're comfortable in spaces with some people aren't comfortable. And I don't want to hog too much conversation there because I'm wondering what Joanne is thinking.
There we go. So Nancy, to add to what you just said, I would also add innovation and creativity is something that I believe nurses bring to the table. I'm flashing back to a story I heard in 2021 about nurses at a particular health system who, upon realizing, all right, so we have no PPE, which was the case across the country. What do we do? And they went out, they had one meeting, and then they went out and bought out all the baby monitors in the geographic area so that they had a way of communicating with patients while minimizing the amount of time they needed to go into the rooms. And so I remember speaking to the leaders of that system and them being completely blown away, both at the idea, but also in the way that the nurses got together, just went out and did it. And I love those stories because that talks about if you are touching people, if you are in front of people every day, you show that care and empathy. You also have this mindset of we need to get things done.
Absolutely. Well, you make me laugh because it makes me laugh because I've had a couple nurses say to me when someone isn't, I don't know, maybe problem solving or being creative, they will say, I think it's because I never worked as a nurse. They will acknowledge that, right? So, and obviously, the pandemic has really pushed nurses to the forefront in terms of having to be resourceful and address all kind of challenges with our patients.
I do think that it's, important for us to find a space or a way to connect our nurses that work in health centers. There is a lot of focus nationally on, helping to heal nurses or address nursing, but it tends to be very kind of hospital focused and not a little bit more toward the preventive and public health end of the spectrum of care where we work in. And so I think, coming together as nurse leaders, how do we create that space and help emerging nurse leaders? I look at it as a workforce opportunity for nurses that are in the inpatient side that are looking for something else, to look at health centers as another, way to embrace their profession and give back to community and work in a different environment. So I think it's a great way to think about that,
I love that. And I love you taking this initiative for us, Wanda, to kind of pull this together. Just a quick story. I had a call a couple of weeks ago from a nurse who's been working in critical care, who was a student of mine about 7 years ago. She's inspired to come to the health center. We had her over, we hooked her on what could be done in the health center community environment. So I think that, continuing this discussion and conversation would be really inspirational to many, and lots of nurses that we could invite to join us.
Thank you. So we start on time, we end on time, right? That was the way we started. I want to thank all of you who have joined us. Please share once this webinar is recorded. Share widely and broadly. My contact information as well as my speakers are a part of the slides. I am a big social media. I'm on it all the time. So if you want to connect with me, it could be via LinkedIn or Twitter. And there's additional resources at the end of this for you guys to look at from the American Nurses Association, Future of Nursing, NACHC Report 2020-2030, podcasts, and other things that please, use and look at on your own time. I want to thank my colleagues at NAC for helping to facilitate behind the scenes. And my speakers today, has been a blessing and an honor to present with you. Thank you, everyone, and have a great day.